Welcome to the NACo podcast. Join us as we bring you stories of innovation in counties across the country, cover local government best practices, and provide updates on the issues critical to local government. The National Association of Counties is your resource in fostering healthy, vibrant, safe, and resilient counties across America. This past January, NACo held a joint Healthy Counties Initiative, Smart Justice, and Justice and Public Safety Forum in Charleston, South Carolina. The forum addressed the challenges and opportunities to improve health, justice, and emergency management systems, and discussed the role of counties in issues such as the social determinants of health on our communities, the reduction of racial and ethnic disparities in local health and justice systems, mental illness and its impact on jails, health coverage enrollment for justice-involved populations, juvenile justice reform, and paying for disasters, among others. Today we'll be covering two of the topics discussed at the forum, but first, some quick background information on the event. During the event, Guilford County, North Carolina Commissioner Kay Cashin and Fulton County, Georgia Commissioner Joan Garner, respective chairs of the NACo Justice and Public Safety Steering Committee and Healthy Counties Advisory Board, emphasized the intersection of health, justice, and public safety systems as the impetus for the joint forum.
Being the chair of the Healthy Counties Initiative Advisory Board, it was very important for me to be here. That's the number one reason. But secondarily, because health and justice are the two largest items generally in a county budget, there has to be some overlap and some attention paid to both. So when the invitation went out to partner with the Justice and Public Safety Steering Committee, I thought that's a no-brainer. We have got to work together, work across disciplines to figure out how we're going to address the issues that are affecting so many of our citizens.
Well, JPS addresses issues that across the board affects all of our counties, all of our citizens. When we talk about juvenile justice, when we talk about mental health in the jails, one of the most important and costly issues that counties face, it's important to come and to be able to exchange ideas, to hear from the professionals that do presentations for us, to interact with not only the pros, but with our other members representing counties across the U.S., because what works in one county may work in another if you know about it.
You know, this was an awesome conference, and there is so much information to take back. But I think what's important is that former Congressman Patrick Kennedy said, smart economy is what we have to strive for and really develop if we're going to be effective. We have been entrusted with the public's trust to be good stewards of their taxpayer dollars. And so we're going to have to figure out how to do our work in a smart way. And so I really hope that my colleagues will understand that there are certain social determinants that affect everyone in our community. And unless we address them, we're not going to move forward.
Counties play a major role in addressing the social determinants of health. As the local safety net for health and social services, enforcers of the law, and the entities responsible for policy making and programming decisions, counties are in the unique position to impact individual and community health and safety. One area where many counties are working is addressing racial and ethnic disparities in the community, as evidenced by the rates at which minorities are involved in the justice system. During the forum, Mr. James Bell, founder and executive director of the W. Haywood Burns Institute, discussed his work with counties to reduce racial and ethnic disparities in the youth justice system, working closely with judges, law enforcement, probation officers, attorneys, community organizations, and families to engage this seemingly intractable problem.
Young people in the justice system are often there because other systems have passed them on to the justice system for things that are normal adolescent behavior, normal adolescent problems, and because those other systems don't want to deal with them because they're either more aggressive or they're violent or they commit some small criminal act, that they end up in a justice system that is not serving them well and really reduces their life outcomes. And so I tried to bring the message that we should be doing other things with these young people and trying to get them interventions and services rather than custody, control, and suppression. County commissioners have a tremendous amount of power in terms of how their justice systems operate because they write the checks. The justice system comes to the county commission, and I'm sure it is a large part of the county's budget in terms of operating health systems and the justice system. And so the county commissioners can be very helpful in having justice systems be accountable for their recidivism rates, accountable for how they spend their money, and accountable for the services that they're bringing to young people that have multi-system needs. So, for example, in one of the counties that we worked in, when we looked at data, and we disaggregate data by race, ethnicity, gender, geography, and offense, when we did that disaggregation of data and looked at a year's worth of offenses in the way that I've just described, what we found out is that Latino youth were mostly arrested for domestic violence. And so in order to address that problem, we said domestic violence is a social problem. Yes, it manifests itself in some kind of violence or threats, but ultimately, even if you adjudicate that young person, they're going home to the same family problems that they left. So one of the things that we did was, with the help of the county commission, was to create a domestic violence center so that when the law enforcement officers went to the home and there was an issues there, they would pull that young person or the adult out of the home and then take them to the domestic violence center where they got services. What's wrong with the family? What's the family dynamics? Oftentimes it was the teenager spoke more English than the parents, and so the teenager had a sense of power that was undue for the family structure. And so there you get services, and we don't just lock you up, put you through this thing. We actually begin to attend to the root cause of the problem. Right. So we believe that in order for any system to be accountable, it needs to have data to determine what happens. Oftentimes, people only go by fantasy, like we have a big drug problem or all these kids are doing this kind of stuff. But the data often doesn't bear that out. And so what we want to do is get rid of anecdote, get rid of the 6 o'clock news. We want to find out, in a year, what were the young people referred to by race, ethnicity, by gender, geography, where they live, are there certain zip codes or precincts that are more important than others, and offense. And we want to know exactly the crime, not a category of crime. We want to know what the young person does so that then we can aggregate that data and find out who it is that this justice system is serving. It's a very different justice system if you're serving robberies with weapons rather than serving kids that are not in school. Those are very different things that you would set up to address that problem. However, if you don't know that, you treat them all the same, and in fact, you get worse results.
Another major intersection of health and justice in counties is that of behavioral health and the justice system. An estimated 2 million people with serious mental illnesses are booked into county jails each year, and estimates are that almost 3/4 of inmates with serious mental illnesses have co-occurring substance use disorders. To effectively treat this population, justice and behavioral health systems must collaborate and communicate. Judge Steve Leifman of the Miami-Dade County Court Criminal Division is at the forefront of a public policy movement in the criminal justice system to reduce the number of people with mental illness in prison. During the forum, he discussed the current state of behavioral health and justice and how county agencies are currently working to tackle this issue.
I think county commissioners have a huge role. As I discussed earlier today, about 80% of the solution is in the local government. And unfortunately, because the federal government, and that's kind of the other 20%, the state and federal government, they don't necessarily pay for the right services that a lot of this population needs to actually recover. And so we do need to start working with the federal and state governments to start getting them to pay for different services, not just medication, but services that actually help someone recover, which would include things like trauma-related services, peer services. There's absolutely no reason that we're cutting people's benefits off once they start to work. These medications are very expensive. The actual act of working helps the brain recover, and so there's a lot of incentive to want to keep people working. They pay taxes. It just is good for everybody, and so we need to start changing some of those systems. And also, I think the county commissioners can play a huge role in acting as the facilitator in the community to bring all these non-traditional stakeholders together that need to be brought to the table to make the structural changes to improve the system. And it's really about helping the community to develop a better system of care so that people can get better access. And I'll give you some very specific examples. And as an example, to show you how difficult it is, in Seattle, they took county commissioners, the sheriff, the judges, the state attorney, the police to a local park. And they took their shoes, purses, and wallets away from them. And they said, okay, you're homeless and you have mental illness. Tomorrow morning, you need to be in court at 9 o'clock. And then at 11, you need to go see your probation officer. At 1 o'clock, you need to go see your psychiatrist. And at 2, you need to go pick up your medication. And when you think about the problem in those terms, what you realize is that we created a system for people that are not sick. This is not a Monday through Friday, 9 to 5 illness. And so the first thing you have to do is to start to think about what kind of system will work for people that are ill, and how do we make sure we can do that. And so from the court side, we started slow. We brought all these traditional and non-traditional stakeholders together. We started with our law enforcement. We're a large urban community. We have 36 police agencies. We have 3 million people or more in the community. We're very large and dispersed. And so we started slow. We started with a couple of police departments that were willing to do what we call crisis intervention team policing. It's a 40-hour program where we taught our law enforcement how to identify people who had mental illness, how to de-escalate as opposed to escalate, and where to take them as opposed to arresting them. We now have all 36 agencies trained. We have over 4,400 police officers trained in Miami-Dade County, and it is enormously successful. Last year, or for 2013, the city of Miami and Miami-Dade, my two largest police agencies, combined did 10,626 mental health calls. Yet, they only made 9 arrests. And as a result of that, our jail has plummeted. It went from a high of 7,800 to today, January 22nd, 2015, to 4,400. It enabled us to close the jail. It enabled us to find the space we needed to build out a new area for people with mental illness, because the area we were using before was inhumane and despicable. And we've been able to close that grotesque part of the jail, and now we've opened up this state-of-the-art area that really is going to treat people with mental illnesses the way they should be treated. So that was one piece. We also realized some people may not be manifesting symptoms at the time of arrest, so we need to have something in the system as well. And so we started out slowly, and we set up a misdemeanor diversion program. So if you got arrested on a misdemeanor and you had a serious mental illness, we now have put into a place that within 24 to 48 hours of the arrest, we have the person diverted to one of our local crisis stabilization units. We get them stabilized. The 72-hour involuntary hospitalization law does not apply since they're on a criminal hold. We send peer specialists to go see them, to start to work with them, encourage them to get help. And if they agree to go into our program, they're not rebooked. They're physically taken from the facility directly to the courtroom, where a system of care is put into place, where we help them with their benefits, where we help them find housing, where we help them learn about recovery. And then the court, in some cases, will continue to monitor them. And it's grown amazingly well. And that program has reduced our recidivism rate among our misdemeanor mental health population from about 72% to 20%. Very, very successful. We then expanded it to a felony diversion program. So now people that are getting arrested on nonviolent type or low-level felonies, which is all of our third-degree felonies we do, and nonviolent second-degree felonies, they don't get out as quick as they might on a misdemeanor, but they're identified, they're screened, they're assessed, and if they meet the criteria for the program, we get them out of jail, we get them into treatment, and we do basically the same thing we do on the misdemeanor. Then they're brought back to court, they're put into a program, and our state attorney has been fabulous. They'll actually drop the charges if the person qualifies if they successfully complete the program. That program's holding a recidivism rate of about 6%, which is phenomenal, and that program has saved Dade County over 35 years of jail bed days already because they're not getting rearrested.
In addition to addressing racial and ethnic disparities and mental illness's impact on the justice system, NACo's Health, Justice, and Public Safety Forum covered a wide range of issues. For more information and resources from the forum, go to www.naco.org. Also, be sure to stay tuned for more podcasts on these issues. If you enjoyed this episode, be sure to subscribe. Head over to nacopodcast.org to subscribe via iTunes, email, or RSS, and get instant access to new episodes as they are released.